Good afternoon.
Did you tell the group?
No.
Yeah.
Let's get started. I want to thank everyone who's here today. My name is Becky Palmer, and I'm part of Indivisible Greater Grand Rapids. Some housekeeping. The women's washroom is right out here in the hallway. The men's is right back there. And we want to thank Fountain Street for allowing us to use this space for today's press conference. I'd like to thank the members of the press who joined us today, and I would also like to thank everyone who is here today. I know you are here because you're angry, frustrated, and afraid. And you are also here because you care about the sick, the elderly, and the children who currently rely on Medicaid and SNAP food programs for survival. As a nation, we are currently facing the possibility of severe cuts to programs to supplement and protect our citizens who cannot survive without this assistance. This current administration wants to cut the federal budget by trillions to give their billionaire buddies a tax cut. It seems these cuts are meant to hurt everyone at the bottom, so the money goes to the people at the top. They want us to believe that these programs are impacting and interfering with everyone's ability to live comfortably and to get ahead. The rich are feathering their nest with these cuts. Why are we focusing on these particular programs today? Because House Republicans just voted for a budget proposal that would kick millions off Medicaid, food assistance, housing, and other life-saving programs to fund tax breaks to make the richest even richer. Now they need to figure out how to turn their unconscionable plan into reality and hope that voters in their districts are too distracted to realize they've been sold out. Many of us have had the privilege of not being vulnerable nor suffering because we don't have adequate health care or food security. Perhaps looking at some numbers will help all of us to understand what and who is at risk should these cuts to SNAP and Medicaid occur. According to recent statistics, the population of Michigan is just over 10 million, and the population of Kent County, Michigan is just over 660,000. According to the Green Book report of key program statistics, in Kent County, there are 76,000 people receiving SNAP benefits. Of that amount, 36% are households with older adults over 65, 43% are households with children, and 51% are households with a disabled person. And there are 116,000 people receiving Medicaid and 38,000 in the Healthy Michigan program, which is part of Medicaid. This means 1 in 20 Kent County residents is on Medicaid, and 1 in 11 residents receive SNAP benefits. According to research from the Food Research and Action Center, SNAP supports working families. 78% of SNAP households in Michigan included someone who was working. SNAP supports local businesses. Now pay attention to this. SNAP supports local businesses, including 10,000 retailers in Michigan, which redeemed a total of $3.6 billion in 2023. Those retailers include grocery stores, farmers markets, which contribute to local taxes that fund services like schools and health care. Well, we've got news. We're all paying attention. And we're not going to remain silent about the current administration's proposed policies and program cuts. Our well-being is deeply connected to the well-being of society. Elie Wiesel reminds us, there may be times when we are powerless to prevent injustice, but there must never be a time when we fail to protest. This administration has endorsed a House spending plan that would cut $880 billion from the departments that administer Medicaid. We at Indivisible Greater Grand Rapids believe that we need to drill down and see how the funding cuts will impact people on Medicaid and SNAP. We have invited 4 people today here to share their stories and the real-life consequences of having these programs cut. I want you to listen closely because these are real people, these are real stories about what will happen if these programs are cut. So based on the numbers of people needing Medicaid and SNAP benefits, as well as hearing the stories today, We must understand that these people are our neighbors, members of our congregations, people working at grocery stores and other businesses in town. In some of the residential programs for adults with developmental disabilities, they have programs that teach them work skills. Today we're going to hear from folks who have a story to tell us about themselves and or a family member. Please listen closely to these stories and understand how these budget cuts will hurt families and individuals. Please welcome today Andrew Solinsky. Did I get it right? Okay. Andrew Solinsky.
It's a privilege to be a parent, a grandparent, a family, a friend, a neighbor of a child, to watch them grow, to see the setbacks and life lessons, to see the person they become. It's also a privilege to never have to worry about how cuts to Medicaid will impact your child. You don't have to worry about how you'll afford the medications to keep them alive. You don't have to worry about not if, but when the next ER visit is going to be and how it's going to impact you financially. You don't have to wonder if your child will die as the direct result of a bureaucratic signature from someone who has never met your child. My daughter Lily is an extraordinarily happy 19-month-old who's full of life. She loves hearing her 3-year-old brother Theo play next to her. She loves loud music, bright sounds, and wind stimulation. When my wife was 20 weeks pregnant, we found out that Lily had a brain bleed. This was obviously a terrifying time for our family, not knowing if she was going to make it to birth. Shortly after birth, she made it. Neurology told us that when looking at her brain hemispheres, it was not a question of good and bad, but bad and worse. Obviously not what parents of a 6-day-old want to hear. Then we received the news that Lily's hearing and vision didn't seem to be quite on track. So by 3 months old, she had hearing aids and glasses, which not only made her adorable and endearing, but also allowed her to interact with the world around her. Her hips would crack and pop, so orthopedics put her in a hip brace. The treatments and conditions seemed endless. We were referred for comprehensive genetic testing, where we found out Lily has a life-limiting neurodegenerative condition called PECD. Much of the research shows that kids like Lily won't live past the age of 4. Despite everything we had overcome as a family, this was the time that was most helpless and dark in my life. I couldn't protect my child, and I couldn't save her, but we persisted. Lily regularly is overseen by half a dozen specialists. She's on a medically prescribed ketogenic diet to help manage her neurodegeneration and also manage seizures. Despite everything we had overcome, this has been a really challenging period in our lives. My wife Holly takes Lily to weekly OT and PT appointments. Lily has equipment to help her bathe and stand and walk independently. We traveled far and wide for Lily to attend specialty clinics to help her live the fullest life possible. In addition to being an incredible human, Lily is also playing an important role in this discussion today because Lily is the face of Medicaid. Her recent seizure medication costs over $17,000 a month, and it's not covered by our primary insurance. Her medical equipment, of which we've just scratched the surface, has accumulated over $10,000. We recently had an emergency admit to the hospital where I learned how to place an NG tube in Lily so she can maintain nutrition even when she wasn't able to take things orally. We found out this morning that tomorrow we're going to have surgery tomorrow for her to have a G tube inserted, so that way we can continue to make sure she gets the nutrition she needs. All of this was possible because of our access to Medicaid. Kids like Lily never asked for the life that they were given, and yet strive in ways that we would never anticipate. There are nearly 1 million children enrolled in Medicaid in Michigan. Cuts to the program do not only threaten access to health care, but will also assuredly result in thousands of deaths to kids like Lily. So what can we do? Call and text and email your city, state, and federal representatives to let them know how much Medicaid means to the millions of people across the country. Not just people who are low income, but people with disabilities, older adults, kids with complex medical conditions. The list it's a really important and vulnerable list of people that we are impacting. Let them know that it's not only going to be shown in protests and demonstrations, but it will also show up in the polls. Get involved. Find your local disability Facebook group. You would be amazed at what's out Volunteer, donate, and take the simple step to perform some action for your community. You guys are already here, which is the first step. But disability groups, older adults are well represented. Adults with physical disabilities well represented. Kids often get left behind in those conversations, so we welcome you. Finally, we have an annual fundraiser that we do at the Fulton Market. Last year we raised over $50,000 for Lily's Foundation, for the Foundation for Lily's Condition. It's on May 4th. It's a free family event, and it includes live music, children's activities, food trucks, over 100 artisan vendors who will be donating a portion of their profits as well. You are never prepared to have a child with a disability. However, having the supports around you, including Medicaid, make a world of difference in having a few more moments with your child, and that's all I can ask for. Thank you.
Our next speaker is Dawn Vinton, and she's going to tell us about her sister.
Good afternoon. I'd like to tell you a little bit about my sister Christine. We call her Chris. She's 69 years old. She's my older sister by less than a year. She's diabetic and awaiting a kidney transplant. She also has essential tremors that make her life quite difficult and a little messy at times. My sister is shy and quiet and somewhat of a reserved person until you really get to know her. I would say we're complete opposites. My sister's devoted to God and she is quite patriotic. Chris also loves the color orange. If she sees something orange, she'll want it, whether she needs it or not, no matter what it is. But her favorite thing, she's a collector also, and her favorite thing to collect are different kinds of dolls. And right now she collects Yoda dolls, and we take them, the dolls, on adventures. We go out in the community and go to places like Meyer Gardens and set up dolls, and we get quite a few looks. I guess it's quite a sight to see 2 or 3 older women playing with dolls and taking pictures. But she likes to do that. She posts them on Facebook and Instagram and has a lot of fun with it. So that's what we do for fun and excitement. We grew up in Grand Rapids on the near west side. And when Chris was about 19, she had a disagreement with our father and said she wasn't going to live under his thumb anymore. And she had a friend moving to the UP to go to college in Marquette. And the next thing we knew, Chris was living in Marquette and going to school. And she made a life there for the next 40 years or so. She married but never had children, and she's widowed now. And she got really sick a couple of years ago and was put in a care facility in the UP. And the closest we could get her was Sault Ste. Marie, which was still 4 hours away. And it took us about 6 months to get her moved downstate. And while she was at the care facility, it wasn't going well. She was really unhappy, and it was very obvious. We as a family were quite concerned about her mood and her state of mind, and the staff was also worried. So they offered her a Medicaid waiver, which allowed her the ability to live at home independently with a lot of help. I am her primary caregiver. I do most of her cooking, but she does get services through this program. 12 hours a week. She gets someone that comes in 3 days a week for 4 hours. They do like housekeeping, some shopping, and anything she needs done. I'm unable to do a lot of her physical things because I also have limitations because of my age and disabilities. But I'm very concerned that if these programs were eliminated, she would not have these services. We also are offered a ride service that transports her to dialysis 3 days a week, which is necessary because after dialysis she's quite tired and drained, and she needs her wheelchair. And I'm not able to transport her in a wheelchair. It would be almost impossible for me at this point. So it's very necessary. And we're very fortunate to get her into subsidized housing. And that's a whole other topic. But right now my concern is Medicare and Medicaid cuts, especially Medicaid, because without this waiver program, I don't know what we'll do. You know, when she wasn't doing well at the nursing home, I offered to have her come to my house and she firmly refused. So then they said, you know, let's try the waiver program. And I was very frightened, and it took a lot of ER visits and a lot of work on my part to keep her healthy, and a lot of help that I received through this program. So, thank you for listening.
Thank you, Andrew and Dawn, for sharing your story and being so courageous to share your story in such a public way. The next person we're going to hear from is Mary Glider, who's going to tell us about her brother.
Hi, everybody. So my brother Patrick is 67 years old and was born with brain damage. He has about the mental capability of a 6-year-old child. Because there were no schools for children like him back in our state in the 1960s and 1970s, he was sent out of state to a special school in Kansas, and he was there for about 10 years. My family was not well off when I was a kid, so we only saw Patrick twice a year. Our summer vacation was always the whole family driving down to Kansas to spend the week with Patrick in Kansas. I know Kansas from the 1960s like the back of my hand now. And I found out, and Patrick flew home at Christmas, and I always wondered how he was able to fly home. Like, where did we get that money from? And my sister told me about a year ago that my dad's boss actually bought Patrick's plane ticket every Christmas so that he could come home. That's a real mensch to do that. So he came back home when he was 18, and he moved into a group home. The group home provides him with a roof over his head, food, social activities, continuing education, and a job. So my brother, who's like a 6-year-old kid, worked from the time he was 18 until he was 65. He retired 2 years ago. He made something like 40 cents an hour. So they didn't pay those jobs really well. You know, so right now, all his medical and dental and special services come through Medicaid. So those are the facts about my brother, but I'd like to talk about what makes Patrick Patrick. So his heroes are Batman and Superman, and we see every Batman and Superman movie that comes out. He still believes in Santa Claus and the Easter Bunny, and sometimes I wish I still did too. His favorite foods are chicken, salad, and anything with noodles, or as he calls them, new-news. He loves his family, and he just lives for visits from his 88-year-old mother and me. When we get together, there's a variety of things that we like to do. We'll do simple jigsaw puzzles. We'll take my dog for a walk. We'll go shopping. Patrick loves to push the grocery cart in the store. He just lives for that. We'll watch movies and we'll cook dinner together. He's able to do simple chores like chopping vegetables, making a salad, and setting the table. He can print his name and he can read a little. He can point out the words chicken, spaghetti, or salad on any restaurant menu. Every visit with him ends up with him showing me his empty wallet. He'll literally open it up and say, "Can I have a $50?" $50 is Patrick's term for paper money. He learned a long time ago that change doesn't buy you anything. This past year, I became Patrick's co-guardian along with my mother. We worry about health care for Patrick and people like him if Medicaid programs were to be cut, or God forbid if you ever had to go into a nursing home. It is every parent's worst nightmare to have a developmentally disabled child and to wonder who will take care of them when I am no longer around, and I can no longer do that. I also have this fear for my brother, and I worry about him outliving me. I know that all parents and siblings of special needs people share these same worries, but with Medicaid there will be funding to provide for their child or their sibling. Both my mother and I are in Social Security and Medicare, and neither of us really has the ability to care for Patrick full-time. And it is a full-time job to care for him. You can't just say, okay, Patrick, go over there and entertain yourself. You are literally providing activities minute by minute. Like many senior people, Patrick has health care issues that come with advanced age. Recently, he had a high PSA test, and so now we're worried about prostate cancer. Also, he's been hallucinating a bit and having conversations with imaginary friends. So now we're having to think about dealing with urologists and neurologists and otherologists and maybe even a cancer care team. Right now, Medicaid provides a very basic level of medical and dental care for him. He has no savings of his own. I mean, who would have savings if they were making 40 cents an hour? And could not possibly cover the cost of Medicare, of health care, if his Medicaid benefits were cut. So I would ask all of you, please talk to your representative and senator and ask them not to cut either Medicare or SNAP for that matter. I firmly believe that when we protect the most vulnerable amongst us, we protect us all. Thank you very much.
Our last speaker for today is Dr. Steve Ashmead. He's going to talk about the consequences of Medicaid being cut for patients, but also some family members. Thanks, Steve.
I just wanted to start out by thanking Andrew, Dawn, and Mary for sharing those personal stories. They sound a lot like the patients that I saw and took care of during my career. I am a retired family physician, and I cared for patients in West Michigan for over 35 years. Throughout that time, I was a physician at downtown at St. Mary's Hospital. Initially it was part of Mercy, then of course it became Trinity Health, which you hear from me today. I also had the ability to, way back in the day, a doctor could actually work at all three. I worked at Butterworth and Blodgett and St. Mary's. It was a little bit too much, so I'm not sorry. You can only do that. But additionally, in addition to my patient care, I was a teacher of medical students and young healthcare professionals. I was the associate director of the family medicine program. And you have to realize that oftentimes residency programs end up being safety nets for healthcare, that the patients that other physicians somehow never find room for in their practice end up being part of the care of the hospital. And again, St. Mary's, that was part of their mission. That's not to say that Blodgett and Butterworth didn't do the same, and also what was then Metro and now is U of M West. And it's always part of the mission. That's part of what hospitals do, is to pay for is to care for the underserved. Today, I remain on the faculty at Michigan State University, where again, part of what we do is teach the medical students the necessity of realizing that they have to care for the full spectrum of patients. Today I'm speaking from my personal experience as a provider, an educator, and as a member of a community that really is reliant upon Medicaid funding to provide the necessary care for all members of our community. Beginning with my medical training in 1976, Medicaid has been critical to providing the necessary education to patients that I saw in the urban, suburban, and rural hospitals that I worked in. Pregnant women needing prenatal care, children sick with meningitis, victims of violence, people with severe mental illness, and the elderly are examples of the underserved, marginalized people that I cared for, who without Medicaid may not have survived. My colleagues at Trinity Health assure me that the continuation of Medicaid is the highest priority to the organization. And I don't know anybody at the other hospitals, but I assume that it is still a priority. And the reality is, it's not as if any of the healthcare systems are so well off that they cannot have that 5 to 10 or 15% that comes from their Medicaid patients. And if you go to a rural hospital, that could suddenly become 30, 40, and 50%. And you know, it's an interesting statistics that if you reduce Medicaid spending, how many rural hospitals would close, and they are already closed. So it's a whole nother issue about the underserved people outside of the large metropolitan areas. My knowledge of the healthcare system in West Michigan is that providers would not be able to adequately serve the healthcare needs of our community without Medicaid funding. I too, like Andrew, have a son. You have a daughter, but you know, same idea. Children that for the past 40 years I have been, and my wife have been living that battle of supporting him. Shortly after he was born, he had to have emergency surgery and developed complications. I was serving in the Indian Health Service at the time in New Mexico, and he spent 6 weeks in the ICU in Albuquerque, and it was probably some of the darkest times of our life. We didn't have Medicaid then, but we had really good benefits from the public health service. So, I mean, it's just one thing or the other. Medicare, Medicaid, these funds all come from our tax dollars ultimately. And it's really, the federal government makes sums like that's coming out of their bank. It's coming out of our pockets. We pay a significant amount of the taxes. I'm not going to tell you that people in the top 1% don't pay a lot of taxes, but they make a lot of money, so they can afford it. But I was fortunate in that when I was employed by St. Mary's, my son stayed on my insurance until I retired. And Medicaid was still secondary for him. And he relied, again, I was able to get dental coverage and everything else. But once I retired, he is on Medicaid. He too lives in a group home with 4 other men, and as far as I know, they're all on Medicaid, and all of his friends are on Medicaid. So it really helps to support people in this situation. My sister-in-law was able to provide for all of her health care costs until 2024, when after more than 4 years of paying for full-time nursing home care, she exhausted all of her resources. And nursing home care is something like $12,000 to $15,000 a month. And yes, she had multiple medical issues, but she just went on Medicaid within the last 6 months. She does have Medicare as well, of course. We must all admit that Washington is asking for Medicaid cuts not to improve the efficiency of health care in America. I've looked at the process of medical care in America from the day I began medical school at the county hospital in Houston, Texas, to my time in Kalamazoo, to my time on the Indian reservations in New Mexico and Oklahoma. We don't do a very good job of spending our money wisely. But this whole discussion about decreasing Medicaid funding, it isn't about that, of using the money better. It is, the current administration seeks cuts in Medicaid funding in order to continue the funding. The tax cuts first started in 2017. And you can guess what started in These tax cuts overwhelmingly benefit the top 10% of wage earners. I'm honored to gather here at Fountain Street Church, which has been an advocate for the underserved for over 150 years. All churches, all congregations should agree that our community is best served by the continuation of Medicaid funding. My reading of the Bible challenges me to take on the role of the Good Samaritan. I implore the people of West Michigan to tell their legislatures to support continued Medicaid funding so that we may all participate through our tax dollars in the care of those in the community who need help in paying for health care. Thank you.
Thank you, Steve. I'm going to open it up for questions. If there are questions any of you may have, we can do that at this time. Yeah.
My frustration.
Oh, hang on a second. You want to do the mic over?
I forgot my microphone girl. My frustration is that when I have this conversation with the other side, the answer I get is, he promised he's not cutting Medicaid. Try to explain to them the math doesn't add up. But if you have any magic words.
Well, the math doesn't seem to add up, but also the promises haven't always been kept either. That's what I would say. Other questions?
What's the next protest? We've got to keep making ourselves heard.
Yep.
Yeah. We've got to
Saturday.
make people.
Saturday.
You can call all our legislators, tell your neighbors, everybody. This is reality.
So what you heard, the 4 people who talked today, they all said, call your representatives. It's an easy call. If you don't have it, there is an app that you can get. It's called 5 Calls. It has the script, it has the people, it has the phone numbers, and you just make your phone calls and let them know. Any other questions? Yeah.
The 5-call thing, unfortunately, a lot of them now are hiding from phone calls, so you have to send emails. So I just did 5 calls today, so like Heisinger, for instance, he won't take a phone call. So, it's really important that you don't give up, and then send an email.
Right. Don't give up. Send emails. You know what? And let other people know. I mean, the reality is we pay their salaries. They're our representatives. And to not show up is a form of taxation without representation. So keep in touch with them, find them, and let them know what you think. Yeah. Any other questions? Okay, Alan's going to tell us about the rally on Saturday.
So this Saturday from noon till 3, we will be rallying just outside the downtown convention center, and we're centering our protest on the cuts to national parks, the EPA, and other agencies that protect our natural resources. This is very thematic because inside the convention center for a couple of days will be an outdoor sports show, and so lots of people going in and out are anglers, hunters, boats people, and we're hoping that they can learn about the dangers in the upcoming cuts to resources that they truly appreciate.
Isn't that a bridge protest Friday on Pearl Street?
Yes.
Yes?
Yes,
Yes.
from 4:30 to 6:30.
Is there a specific focus on what's just a general, we're mad? Yeah, we are. We've got to make ourselves known, folks. Yeah, you're right. We've got to make noise.
Saturday.
All right, we'll see you Saturday.
Amen.
All right.
Heart and soul. I want these kids to be okay. And I don't have kids. I love your daughter already.
I think she'd like you to.
Thank you.
If there are no other questions, I'm going to wrap this up for us today. I just really want to thank the 4 people who talked today. when we help and care for each other. Franklin Delano Roosevelt in 1937 stated at his second inaugural address, "The test of our progress is not whether we add more to the abundance of those who have much. It is whether we provide enough for those who have too little." As a nation and its citizens, we will be judged by how we care for the most vulnerable among us. Thank you so much for coming today.
Thank you.